Okay, today's morning medicines are Gorse, which is a Bach flower remedy, and it's good for those who suffer uncertainty. Whether it's your health, uncertainty about your health, uncertainty about a test, uncertainty about your money, your life situation, whatever it is, any uncertainty in your life. And that is, I did this, the uncertainty one before, because there's a few medicines that go into them that have the same symptomology, basically. And this is more emotional stuff than that. When I say emotional, I mean if you have a physical injury, it emotionally does something to you, which I'll show you in a second. Serrato, scleranthus, gentian, hornbeam, wild oat, and of course gorse. So I did gentian before, so pretty much a similar symptoms of uncertainty in life. And just like this one here, oh, and the other one is Gossypium, which is cotton plant. So this one here, like rescue remedy, any injuries, any shock to the system, basically, is what that one is. And that has in it cherry plum, clematis, impatience, red rose, and Star of Bethlehem. So those are all for any kind of, whether it's a physical injury, an emotional shock, any kind of shock. My mentor said, when you come up on a scene, usually an accident or something, you would right away consider arnica, but you would having Star of Bethlehem is a great one to have because some injuries like that, you come up and they're fine. If they say they're fine, that's arnica symptom. But even when they say they're fine, it may be an emotional shock to them, and you would go with aconite. So there's different things you consider along those lines. But this is the Bach group of for those who suffer uncertainty, together with those other remedies. The remedies help those suffering from states of doubt, hopelessness, uncertainty, and lack of clarity of purpose in their daily affairs. So this person's doubts what they're doing. They're not they oh, this is never going to work out. This kind of person, man, I don't know which way I should choose. This way, that way, the other way. Well, just choose a way and try it, and you'll know. I remember Robbins talked about a general, and he wasn't briefed on the whole situation, but for like 5 years they were talking in the army about these two approaches to a situation. So his guy, I guess it's like a page. He reads all the stuff and then briefs them. And he says, I didn't brief them very good, but when they came in, they gave both their scenarios of what would happen. He said, that one. And they went away and did it. And the guy said, sir, can I speak? He said, yeah. He said, how did you choose that? He said, I didn't brief you enough to know which one was right. And he said, sorry, I don't mean to get into this. I digress. He said, they've been, discussing this for 5 years. You choose that one, try it. If it doesn't work, then you do the other one. you know. So making a decision is a big thing in your life. And Gorse, this person just can't make that decision. They're just, and it becomes hopeless. Where unlike if you take that one way, it doesn't work. At least you tried something. You're in activity. That takes you out of that hopelessness. You at least have some hope. Oh, that didn't work. So then you change. And that's the other end of that is, people say, oh, I tried everything to lose weight. Okay, everything? What did you try? Well, I tried these three things over and over and they didn't work. So yeah, there's, there's people who, you need to make up in your mind that you are going to choose a way. And this here would help you with that. In the case of true hopelessness, such as a terminal illness, Gorse will help to raise the spirits. And in a terminal illness, arsenicum, a really high dose of that, when they're dying, when they're going out, puts them at peace. I don't know why. I don't know what the deal is, but that energy from that arsenic, very high, arsenicum, which is arsenic, very high, just puts them at peace and they rest and then they, eventually pass when it's time. Lowered vitality and sinking of strength happens. So they're, and you think of a depressed person, what are they? Hump shouldered, they're, talking low, they're not very excitable. Yeah. So loss of strength, vitality, The Gorse state is not confined to sickness, but can be experienced during various situations of life, in business and family life. Whenever a situation seems hopeless and one resigns to it, they just give up. You would consider Gorse, and I don't doubt Gorse is mixed with all those other ones. What the heck were they? Rock Rose? Well, no, Rock Rose is the other one. Serrato, Scleranthus, Gentian, Hornbeam, and Wild Oat. And it would have Gorse in there. I don't doubt they're all mixed together, just like they did with the rescue remedy. Let's see. Gorse state of family life. Whenever a situation seems okay to health, it is a state of lowered health, dangerous for those in sickness. So those who are already sick or has some illness, they'll get worse. So this will bring up their vitality, help to bring up their vitality, their desire for hope in life. A vital force itself is losing its incentive to live and fight on. In the Gorse state, the mind cannot perceive a way out of difficult situations, and all incentive to give oneself to new ideas and hopes is gone. So this might come in handy for a lot of people now. A lot of people are, going to be struggling. And, the real damage hasn't hit yet for America, but yeah, I don't doubt there's going to be some rough times coming up. That smart, though that stock market's high and everybody's rich right now. I've seen it plenty of times. Then the stock market goes down, and now they're like, holy crap, I lost. They gained 30,000, but then in less than a year they lose 30,000. So it's yeah, but it is a state of deep reaching hopelessness and resignation. So this may be a remedy for everybody to, there's probably one that's, stated like this is rescue remedy. That one probably is uncertainty remedy or something. I don't know. I didn't look it up, but I don't doubt they have all them in there that will take care of these emotional states that will give you a sense of relief for, there is a way, and, I make less money now than I ever did in my life. Yeah. Other than, yeah. Anyways, and I'm more content than I have more than I need. It's very wild, and that's that I believe this is a time of my life where God's training me on being content. So and then there will be the like Paul says, I've learned to be abased and I've learned to abound. I had a ton, I have very little, and then I guarantee it'll all come back again. There comes this cessation of uncertain hopes. One accepts one's lot, succumb to adverse forces, denial, and recurring disappointments. Although there is certainty that all hopes are lost, uncertainty still remains in regard to what exactly lies ahead. Although one may appear calm, there is also underlying sadness and a sense of misfortune and suffering. So you can have sadness, you could have anxiety, you could have whatever, but this one is sadness, and they're just like, I'm done. It's over. That's where faith comes in. And I always use an acronym: following absolutely, trusting intuitively, trusting Him. Wait a minute. Faith, Faith. Following absolutely, intuitively trusting Him. There it is. I made that up. Kind of helps remember. I'm always looking into his eyes. Okay, what's next? What are we doing next? So, all right, that is the uncertainty of life. You would consider Gorse with all its buddies, which is Serrato, which is with a C, Scleranthus, Gentian, Hornbeam, and Wild Oat. I should have put that up there, but anyways, you look up Gorse on Gorse, of course. And those who suffer uncertainty, state of doubt, hopelessness, lack of clarity of purpose. All right, let's get on to Nephalium. Wait a minute. Wrong one. The other way. Tomorrow's granatum, which is pomegranate root bark, Gossypium, cotton plant. All right, Gossypium has been mainly used in affections of the female generative organs, so the baby making parts of the lady. It has been taken in the form of the exact extract, which is tincture, to stimulate the uterus and ovaries. So anybody having infertility, this might be one to consider as a food for the uterus and ovaries. And when I say a food, I mean in a tincture form. This plant has properties in there that is good for that. The symptoms. Oh, and we got a cotton tree because I was looking at this, and we got a cotton tree up the way, and I've shown it on TikTok and that before. It looks like it's snowing in the summer when the seeds disperse, but that has salicin, which is aspirin in it. You could take off the bark and make a tincture out of that. I think it's under the bark. I'd have to look it up again, but take it, make a tincture out of that, and you have basically the same substance that aspirin has, but in a tincture form, which probably instead of that pill, it wouldn't burn a hole in your stomach. The symptoms of external organs are strongly marked. So these external organs of the female lady and the ovaries are the seat of the pains. So all the pains are coming from the ovary. If you're just a home prescriber, you wouldn't know that. Now, go to the doctor, find out where it's coming from. You might find out which come and go, and in the uterus are bearing down pain. So you're just considering as a home prescriber, like, oh, it feels like everything's bearing down, pushing out. Sepia is one, uh, Gossypium, and there's a few other ones with that sensation. So you'd have to consider there, ask some questions, and find out where's it starting, what makes it worse, what makes it better, is it related to any other part of your body, like, and as you'll see, this one's related to the heart and that. Intermittent pains in the ovaries is characteristic. The morning nausea, so this is morning sickness, and salivation indicate the remedy for morning sickness of pregnancy. Now that can be morning sickness in a lady just having her menses bad and that, but this is definitely for morning sickness of pregnancy. In ordinary practice, okay, let's do this. Female generative organs is what it's good for. Intermittent pain in ovaries is a big one. So it's not constant pain, but every so often they get this pain in the ovaries. Worse motion, all pains, better rest. So that sounds like bryonia. Bryonia is worse motion, better rest. So you probably would consider bryonia, give it to them. That didn't work. Now you're looking at other remedies and other situations. It could be Gossypium. That's like the guy with the hip pain. Aeschylus is one that works a lot of times. This one may not work. You never know. It could be a bryonia symptom where, if he rests, it's better. If he moves, it's worse. It could be a rus tox. When he lays there, it's worse. And then he gets up and moves and his hip feels better. So I think it's more like rus tox, but we'll see. Let's see. Okay. Oh, I forgot. This is still part of the medical. This is just the worse motion, better rest. So any pains or worse motion, better rest. That's the modalities. This is still in the medical. Tardy menses. So this will bring on menses, and they got a term for it. It was really weird. Fibroids, tumors in the breast, swelling, and these tumors in the breast usually will come with the swelling of the axillary glands in the neck and the pain in the neck. So yeah, it seems to be connected. The breast tumors and the uh, axillary glands being swollen, and that sounds like a tubercular situation, which is a miasm. That's a whole nother thing that I don't want to get into. Sympathetic symptoms of stomach, heart, bowels, and nervous system. So, like I said, this ovaries and the uterus being affecting the stomach, the heart, the bowels. So they're having doesn't have nothing in rectum. They should be having some situations down there. I know they got gas. I'm pretty sure gas, stomach, nausea, vomit. Nope, no gas. I'm pretty sure. I'll read it. I'm pretty sure it says gas. But all these symptoms in the stomach, and this is like a concomitant, the uterus and the ovaries affecting the stomach, heart, bowels, and even the nervous system from disturbed uterus function. So the uterus is not working. It affects the rest of these organs. And that's, that can be the hard part of figuring things out. But the idea is we don't figure it out. We basically go on the symptoms and try to match it. And sometimes it may be a few medicines because I probably don't have Gossypium, and I wouldn't even know if that one would be the one because it could use some more proving to make to get some more symptoms out of it. But Pain in the back, and then a lot of the remedies that are for menses like dysmenorrhea. I think that's the painful menses. Uh, or even amenorrhea, bringing on the menses, which is what this does. Tardy menses, it'll bring them on. Any of that stuff, even fibroids. There's a lot of medicines for these things, so you need something that stands out, basically. Whether it's a pain, whether it's where it generated from, whether it's where it goes up or down, these kind of things will help you to determine between a bunch of different medicines, which you'd be looking in the materia medica to see, which ones would match what's going on with the person that's before you. So the tumor in the breast with the swelling of the axillary glands, eyes. Let's see, is that eyes? Drawing pains over eyes with stinging in pupils. Stinging, I would consider apis in that, which is a bee, Let's see, female hyperemesis, which is pregnant nausea uh, with weight loss during pregnancy, which is not a good thing. So this could be one that would save a baby, save the woman's whole situation. So morning sickness with nausea, you would definitely be bringing this one in with any pregnancy stuff. You would be considering this. Bearing down pains in the uterus, labia swollen and itching. So they'd always be itching themselves and their labia would be very swollen. Intermittent pain in ovaries, that's a 3. So every so often their ovaries would have this pain. I don't know how you'd know it's their ovaries. Maybe they know. Maybe they can feel where it's at. And retained placenta. So after a baby, I imagine this is a clinical discovery because I doubt they gave it to a lady that was pregnant and now has a retained placenta. I don't know, but it's usually they know this is for woman stuff, and then the lady comes in and she has a baby, and now they can't get the rest of the placenta out. You give Gossypium, and it'll release it. Menses, and you think about it too. The placenta gets released. If you don't, you have tardy menses, it'll bring them on. So it's always pushing things out down there. Menses too watery, so it would allow the menses to become normalized with the blood it should have. Fibroids with gas pain and debility. So, is the fibroids related to the pain and the gas in the stomach? I know I've seen gas somewhere. Fibroids with gas and pain in the stomach and debility. So, yeah. Hyperemesis, I did that. Anorexia with uneasy, depressed feelings. So you think about it, the lady's losing uh, hyperemesis. She's losing weight and she's pregnant. She's supposed to be, even when a woman isn't pregnant, they just have this anorexia going on. And scorbicum corpus during menses. This is the pit of the stomach. So they have a depressed feeling down in the pit of the stomach with their anorexia um, during menses. So this is all during menses. But this should be a comma. Anorexia. And I don't know. Let's see. Food. What does food say? I write this stuff down. I guess I wrote this one Friday. Yeah, anorexia with an uneasy, depressed feeling at scrobiculum cordis at time of menses. And that's just the pit of the stomach has this um, depressed feeling. I don't know what that is. It's just like feels like something's pushed down there, and uh, it's all during menses. When they have their menses, they have this depressed feeling, but they have anorexia with it. Pain, cervical region, tendency to draw head backwards with nervousness. So cervical region is, of course, your neck. It draws the head back, and they're just a very nervous person at that point. Pain, burning, then stinging. Burning, stinging, all these things are, they always help. But when you have a burning then stinging, you can be considering a few different medicines. And uh, Gossypium would be one of them. Extended temple and frontal bone. So the pain in the head is from the temple to the front bone, and it's burning then stinging. So, if I would ask somebody, what's your headache feel like I did my wife, stabbing, stinging, burning, throbbing, pounding, she thought longer, she might have said, yeah, it was burning than stinging, and then I would think of, oh, she's having maybe some lady troubles, and that's where it's coming from. So I always consider, and you never want to judge where it's coming from. I always consider with, it's her digestion because of what she eats and, drinks a lot of pop and all that stuff. So, yeah, you don't want to prejudge. You never know. It could be a menstrual thing and you're thinking it's diet thing and it's not. So you just want to keep asking questions till you get something clear. Same thing with her legs. She got the pain. I press. I do. I go real deep pressure on her legs. I do shiatsu on it, and it relieves it. But it's always there. And I've tried a few different medicines. So the etiology, where is it coming from? I'm considering again the diet. The diet. I gave her phosphoric acid, which is what pop is in pop. So I gave her phosphoric acid to see. All these things basically palliate it, but it doesn't get rid of it. And that's, when I hit the right medicine, I'm telling you, it'll be gone like that. And that's the interesting thing. It's like when you hit it right, like a hernia. I got a hernia cell, and I just used the books that time. I didn't know of a hernia off the top of my head. Now I do, especially if it's a right-sided hernia. It was lycopodium. That was the only one, and it was in big bold print. And I said, "Here, try this." Gave her a bottle of water with it in. A couple of days later, I asked her how it was. She said, "Gone." That's how quickly it can happen. Other times, her legs, I'm still thinking, okay, where's it coming from? Legs, headache. You got to consider the whole body. You got to consider the uh, um, history, and you got to consider like like I know she is a NATMER const I think constitutionally she's a NATMER because she has the usual. She'll have a cold sore, which is NATMER. She loves salt, that's NATMER. So yeah, her cravings, all these things come into play to figure out what it is, and sometimes it's pretty elusive. Other times it can be right there. Just like you can just off the top of your head, like now she was like, just doesn't have a desire for food. Now, is that anorexia? Possibly. I don't know what it is, but I asked her, are you constipated? She said, yes. So I said, okay. The same thing I did to my son when he was constipated. Gave her alumina, and eventually I think it took him 2 days. 2 days he started going to the bathroom. By 4 days, I think he was eating. And then 2 weeks, he went through that bottle and he did it again. He filled it up and just started, kept going. And I think 2 weeks his continence was up and he was feeling better. So yeah, that's what I am hopefully expecting to happen to my wife. In other words, she'll start going, because if you're not going to the bathroom, you're not gonna have a desire to eat. So I'll, hopefully she'll start going to the bathroom regularly, and then we'll see about her eating, how it's going, and who knows, maybe it's not the right one, but yeah, usually you can hit it right fairly quickly, but a lot of times it can be just like, what the heck's going on? And that's when, a lot of times you just go to a homeopath. Even a homeopath sometimes will get stuck because, I see them on the calls. They'll be like, they'll ask questions, here's what I'm doing. And they say, yeah, you're doing right. That's what I would be doing. And then they would give a suggestion. Maybe you should think about this. And everybody would throw a suggestion in. And that gives somebody something to think about, because you can't think of everything, So it's always good to have a group. That's why I've built that community, because now there will be a group where I can teach people. And how I'll teach them is by talking to somebody about their situation. And then trying some things with them, and just keep doing people like that and let them discover for themselves how they can utilize this medicine to help, to treat whatever's going on with their family. So that is the key. You have a group like that. That's why I'm in a community, and I'm going to get in a few more so that I can be around these people to throw out some things and say, hey, here's what's going on, what do you think? And they can throw out, they can mention and help you to expand your vision of what's going on with a person, because each person, they're different. They each have different situations. You can have a headache and it can all be different. It could come from a different situation, a different place. That's why, is it stress? Is it gastric? Is it injury? Is it emotional? What's going on? Where's this coming from? And that's where clams comes in. Clams is concomitants, which is, what's it related to? Is it your stomach? Is that why you got these? Do you have a lot of gas with it? Are you constipated? Is that why you're having headaches? Is it where's it coming from? What's it related to in your body? This knee pain, where's that coming from? Is it your hip out of place? Is it, what's going on with you? Um, Location, of course, is self-explanatory. Is it your knee? Is it your head? Now, what you want to know is at the front of the head, just like this one, from the temple to the forehead. Is the front of the head, the back of the head, the sides of the head, the top of the head? The vertex, is it coming from the jaw up into the head? What is going on with that headache? That's the location. Need more than just it's in my head. And then you want to know what it feels like. So clams, etiology. Did you have a car accident? Like that lady, I gave her nat sulf, and she had a head injury. Anybody having head injuries, nat sulf's a great one for, especially down the road when you're starting to have mental and some different symptoms. Emotional symptoms. Like these fighters and that all of a sudden get aggressive and yeah. So, anyways, etiology. What happened? Is it an emotional stress? Is it a shock in life? Did someone die? Did you lose someone? Did you lose your money? What did you go through? So etiology, and then the etiology starts from when you were young. Oh, I had poison ivy. Okay, now you got sora, you got skin stuff going on. Then you go to the next thing is I had pneumonia, I had measles, I had chicken, I had this, I had lost my parent, all these things add up to put a layer of injury on the vital force. So the vital force is trying to throw these things off, and that's what the symptoms are. The symptoms are when the vital force tries to throw off a disease, a sickness, whatever, an injury, an emotional shock. It's trying to throw out this energy, and it comes out in skin symptoms and nose symptoms, mucus and lung symptoms, whatever. So I get off on these tangents. Frequent desire to urinate with burning pain. Is that gonorrhea? Is that just, normal burn? It doesn't say gonorrhea, so I don't know where the burning pain's coming from. But arsenicum's burning. Cantharis is a good one, especially if it's the bladder. But there's a frequent desire. They're always wanting to go. Heavy feeling in both hands. This is an odd symptom. Better hanging them down, you know worse in warmth of bed. So they can't have their hands in the warmth of bed, and they feel better when they're hanging them down. So that's a very weird symptom. Nostrils are swollen and inflamed. So that sounds like stuffiness and that, you know, and an infection of some sort. Doesn't say what kind of mucus. When there's an infection, inflamed, eh, an infection would be like yellow mucus, green mucus, this kind of stuff, but swollen and inflamed sounds like it's stuffed. And that sounds like it's related to, which would be a concomitant to the uterine stuff again. So not only is it affecting the, what the heck was that? The bowels, the bowels. Where are you? I forget what that was. Maybe I just read it. Yeah, I probably just read it. Affecting the bowels, what the heck is it? Where are you? Dang nabbit. Power morning nausea, indicated morning, marked ovaries, bearing down pain, and where the heck was that? Affects a lot of the organs, the bowels, the nervous system. What did it say? Ah, sorry about that. Anyways, swelling and axillary glands of the neck. Oh, that's with that tumor's breast. I can't find that. I know it's affecting more than just the uterus was affecting more stuff. Oh well. Nausea with accumulation of saliva. So this might be that morning sickness. It could be considered in, if they get it when they're having menses. Inclination to vomit before breakfast. So, one makes up with that morning sickness, throws up, you would consider Gossypium. Maybe that's probably one of the great things for this remedy. Rotating pain and pit of stomach. So there's that pit of stomach that has the, dang it, but that's bugging me which organs it is. Anyways, You have that bearing down in the pit of the stomach. Tonsils are swollen in the right, worse on the right. Action similar to ergot. Ergot is a like oats and rye and different things. It's a fungus on there. They make a medicine out of it. So that's ergot. So whether it's ergot, you would be considering ergot with Gossypium with a lot of these symptoms of throwing up and all that kind of stuff. And yeah, Lilium tig, Sabina, Simisophusia, Apis, Acerigya, I forget, Belladonna, Bryonia, Pulsatilla, Sequoia, Sepia, and Ustalaga. All great lady remedies and all that problems, but Ustalaga is corn that has a fungus that grows on it. They make a medicine out of. So, all right, that's Gossypium, great for all kinds of female situations, and Gorse is great. Bach flower remedy, great for uncertainty in life. It might be good for now when everybody's uncertain about their future, how things are going to work out. They can't pay for all the stuff they need to. The gas is high, blah blah blah. Food's high. You know, you need a lot of faith. That's for sure. But Gorse may get you out of that hopelessness. If someone drops into the hopelessness and despair, like nothing's going to work out, and they resign to the fact that it's over, Gorse might help them to get out of that emotional state so that they can start figuring out what they need to do in their life to get things rocking and rolling, baby. So that is morning medicine. You can age, but you don't have to get old. Depends on what you eat, your stress levels. So take care of your stress and how you move. Get up and move, man. That always helps with hopelessness and that. So that you can be kind to your fellow